presented a video in regards to dusting techniques for ureteroscopy. Dusting is using a high frequency, low pulse energy laser to ablate stone into fine powder. We usually use settings over 40 hertz in order to facilitate this. We presented cases for 3 different patients, 2 renal stones and 1 ureteral stone. For the 2 renal stones, we showed essentially starting at 0.2 and 50 hertz for a 120 watt laser. We were able to show that you can break these apart, you can develop the process so that small stone fragments, really dust, come off of these stones, primarily to debulk those stones. For the ureteral case, we also showed similar settings, 0.2 and 50, which we were able to adjust with the 120 watt laser. The primary advantage with the ureteral case is that we were able to prevent large stone fragments from falling back into the field of view, potentially compromising ureteral safety and really the flow of the procedure. So we ended up demonstrating in the video a use of a 120 watt system. The advantage of this system is both being able to use frequencies up to 80 hertz, but also being able to switch using a pedal system between fragmentation and dusting settings, both of those being useful ways to have a more efficient stone dusting procedure. So in conclusion, we find that the dusting settings and the 120 watt laser can efficiently ablate stone material into fine powder, as we think it's going to be a very important part of the armamentarium of urologists in the future for stone treatments, which will also include, of course, basketing and other approaches. Take-home points for anyone who is interested in using dusting: you have to utilize a high frequency, low pulse energy to prevent retropulsion, to dust away, usually at stones that have perhaps a crust on them, and to debulk them. And we found that 1 to 2 centimeter stones are a good target for patient selection for this kind of treatment.